Welcome to the UPMC 20-second Shout Out for Trauma, brought to you by the UPMC Prehospital Care team, along with the staff and physicians of UPMC Emergency Medicine and Trauma Services. During July, all UPMC trauma facilities will institute the 20-second Shout Out for Trauma. This includes UPMC Mercy Hospital, UPMC Presbyterian Hospital, and Children's Hospital of UPMC in Pittsburgh, as well as UPMC Hammett in Erie, Pennsylvania. To ensure the unique and valuable information provided by EMS is received by the hospital staff, the 20-second Shout Out for Trauma creates a defined period in which the trauma team members are anticipating the verbal report. Immediately after assessing and assuring the patient's airway, breathing, and circulation, the trauma team will pause for the EMS shout-out. With our collaborative efforts, the 20-second shout-out for trauma empowers the clinical team to clearly and succinctly share vital, life-saving information. This poster will be located in all UPMC trauma facilities to highlight the 6 points of the 20-second shout-out for trauma. EMS shout-outs begin with the patient's age, gender, mechanism of injury, to include the use of safety devices, and the time of the event. Of note, pre-hospital vital signs should be limited to heart rate, blood pressure, respiratory rate, and pulse oximetry. Only life-threatening and significant injuries need to be reported to the trauma staff during the 20-second shout-out for trauma. EMS crews should inform the trauma staff of pre-hospital interventions, the patient's use of anticoagulants, and pertinent changes in patient condition, such as periods of hypotension or changes in level of consciousness. When arriving at a UPMC trauma facility, the trauma team rapidly assesses the patient's airway, breathing, and circulation. Patients requiring urgent assistance with maintaining their ABCs will be immediately treated by the trauma team. Following this assessment, EMS provides the 20-second shout-out for trauma. For example, this is a 42-year-old male involved in a frontal collision at 13:30. Patient was the restrained driver, without airbags, estimated speed 35 miles per hour. He has blunt chest trauma, complains of pain and slight dyspnea, heart rate of 128, blood pressure 92/70, respiratory rate of 28, pulse ox 97%. He's on oxygen at 15 liters, 16-gauge IV in his left AC, no changes in route, no anticoagulants, no pertinent meds, history, or allergies. In this report, relevant information is shared expeditiously between the EMS crew and the receiving trauma team. The information is organized and contains each element of the 20-second shout-out. Various resources will be provided to assist hospital and pre-hospital staff with the 20-second shout-out for trauma. EMS providers will notice posters displaying the 6 criteria in all UPMC trauma bays. Pocket reference material will also be distributed to UPMC medical command providers. In a forthcoming update, all clinicians will gain electronic access to this reference card via the UPMC EMS Navigator smartphone app, available for both iPhone and Android operating systems. Remember, this practice begins July 2012 at all UPMC trauma facilities. When arriving at the hospital, the trauma team will rapidly assess and manage the patient's airway, breathing, and circulation, and then briefly pause for the EMS shout-out. EMS crews should continue to leave carbon copy run reports, or drop sheets, with the receiving facility staff to ensure that all patient information and additional scene details are relayed. At times, scene information, such as family arrangements or police involvement, may need to be shared with a social worker or other hospital staff member. EMS should continue to provide this information outside of the trauma room to minimize potential exposure to body fluids or X-rays. Thank you for your participation in this program and your continued support of the UPMC trauma system. We welcome feedback regarding your experiences with our facilities and encourage you to submit any ideas for improvement to the pre-hospital care team. If you are not currently using the UPMC EMS Navigator app, you can download this free resource from either iTunes or Google Play.